So my name is Geoffrey Roberts. I'm a clinical research associate and PhD student in clinical biochemistry and an honorary registrar in general surgery. I've been a doctor for 10 years. The last few years I've focused on general surgery. I've spent most of that time around the southeast of England, but I've also had time out working in Zambia and teaching at the University of Cambridge. My research focuses on people who've had surgery to remove or bypass the stomach or esophagus and the often quite severe and unpleasant metabolic and eating behaviour symptoms that patient group can suffer. I'm using clinical and lab-based techniques to investigate the gut hormone axis and derangements in those groups and try and relate that to the symptoms and discover new ways we could investigate and treat this difficult patient group. I've managed to design a research programme that both targets them to investigate and help them, but also uses them as a really interesting group of people to understand the physiology of the stomach and the esophagus and how that communicates with the rest of the body. I've always tried to combine my clinical work with a little bit of research because it's kept me interested in how and why medicine works. And in the last 18 months I've formalised that as part of a PhD in clinical biochemistry. Doing research in this field has completely changed my approach to treating people who've had this type of surgery. It's allowed me to develop a real interest in investigating and understanding the problems they get and start to tinker with how I might approach that in the future.